Hello and welcome back. My name is Sri. I'm an alcoholic. Today we are discussing the topic alcoholism. I've heard doctors and psychologists considering alcoholism to be a mental illness. It's also there in their clinical book DSM-5 and is mentioned as alcohol use disorder. Now, you see family members saying that alcoholism has a physical element. They have seen their alcoholic family members either craving, physically in pain. They have seen them in blackouts and passouts. They have seen how physically, the alcoholics change and the way they deal with the situations around, right? So for them, it's a physical disease. They don't drink, they're fine. Right? When family members say if the alcoholic doesn't drink, he looks good, he's fine. We just want him to stay away from alcohol. Right. Now, the third aspect I would like you to think about is the family members and friends say that recently they have seen that this alcoholic, once he takes in alcohol, he starts changing. He transforms into a different person, talking from a different perspective altogether, right? They also mentioned that the alcoholic has started lying, stealing, manipulating, all the things that they did not consider to be a part of this alcoholic's personality. That's what we call spiritual bankruptcy or spiritual malady. So in this video, let's see the details of alcoholism. Dr. Silkworth was one of the earliest pioneers to work with alcoholics over a century ago. He worked in the City Hospital of New York. Over his years of experience, he realized that chronic alcoholics, in them, alcohol manifests allergy. That the phenomenon of craving that happens in alcoholics is not seen in any other class of people drinking. That means these allergic types, whom we call alcoholics, can never safely use alcohol in any form. That is the reason why, with all the emotional tantrums that family and friends apply, the alcoholic is not able to get out of his alcoholism. Now, when these alcoholics start drinking, which is what we refer to as their drinking career, start of their drinking career, alcohol actually helps. It works well. It improves their confidence. They feel that alcohol is relieving their pain, their inhibitions are being taken care of. So they have this feel-good factor with alcohol. With over years of usage, continuous usage, the feeling fades away, the feel-good factor fades away, and towards the end, they're drinking because they're compelled to drink. They have no other choice. At that point in time, what also happens is they start finding it difficult to differentiate between true and false. Their alcoholic life seems to be the only real one. Hence, they think they reach a stage where they have to be drunk in order to be awake. At this stage, an alcoholic can be easily identified because he'll be restless, irritable, and discontent. He would have already shied away from his responsibilities. Now, for a person at this stage, the only thing that gives him solace is the first few drinks that brings in ease to his body and mind. These men are not drinking to escape. They are drinking to overcome craving beyond their mental control. A lot of family and friends of alcoholics keep saying that only if they could get a little bit of willpower. Let me correct you, friends. alcoholics have a lot of willpower and determination, which they have exerted and even exemplified during days when they can't get alcohol, or it's a dry day, or at places where it is prohibited. They will go out of the way and exercise their willpower to make sure that they have alcohol. Other thing is, even in their normal life, you will see that they are exercising their willpower all the time. Even in terms of defending your emotional appeals, it is exercising willpower. So I would request the alcoholics and their friends and family to understand the fact the word willpower is not the solution for an alcoholic. We will understand that now. With whatever I have said, let's accept the fact that alcoholism is a severe threefold disease. A disease of the body, a disease of the mind, a disease of the soul. Unlike other diseases, which are as bad, like diabetes and cancer, where the doctor is only focused to treat the body. And if the body is taken care of, the disease is also taken care of. Unfortunately, with alcoholism and addictions, since it is now considered to be a mental disorder, it's the psychiatrists who are treating alcoholics and addicts. So they're taking care of the mental aspect of it. But what about the physical craving? So that is why medicine is still not able to bring alcoholics to recovery. We have to understand that alcoholics and addicts to recover is a complex process. They have to be given a program or a process which includes taking care of their body, taking care of the alcoholism in their mind, and also in their soul, so that they can transform into a different person. It is also said that alcoholism is a thinking problem. So when I'm saying that an alcoholic or an addict has to transform, that means he has to change completely the way he has been thinking all this while. That's what is the process of recovery. We also have to understand that not everyone who drinks more than others is an alcoholic. So that brings us to the next question. If you are watching this video and you're wondering whether or not you're an alcoholic, I'll give you 10 simple questions. All that you need to do is be honest with yourself. Answer these questions honestly. In simple yes. Even you don't have to mention no. Wherever it is applicable, just mention yes. The first question. Do you drink more than you intended? At this stage, at this point, in your current situation, are you in a stage where you make a plan that you will drink twice a week, but you drink more than that? You make a plan that you will have 4 larges, but you always end up drinking more than that. So the question here is, do you drink more than you intended? That's the first question. The second question is, lately, have you been considering to reduce the amount of alcohol, to probably cut it off for a while, or change brands? The third question is, how much part of your vacant day do you spend in recovering from the last drink, in planning for the next drink? When I'm saying planning, you're thinking about money, where you're going to drink, whom are you going to drink with, what are you going to drink. The third thing is your actual drinking, how much time you're spending in drinking activities. So club all these three things together and see is it a large portion of your waken up day that you're spending in this. The next question, fourth one, have you reached a stage where a particular time of the day you start getting triggered? In my case, it was mostly in an hour of after leaving job. For some, it is like 7 p.m., 8 p.m. That's when they cannot hold the craving any longer. The next question is, have people started asking you to stop or reduce? Have people expressed their concerns about you after drinking and your drinking, both? The next question is, are you able to make friends? That means, are you able to connect with people emotionally? Is the answer to that yes or no? At this stage, what happens to an alcoholic is that we start moving away from society because of the guilt trip that alcoholics get. So that leads to the next question, which is, have you reduced your recreational activities? Are you at a stage where you are only going for social gatherings or recreational activities either when it is absolutely mandatory or that activity involves alcohol? Eighth question, are you a functional alcoholic? That means, do you function? Do you go to office? Do you work? Do you drive when you're drunk? The last two questions. The ninth one is about health. When you're drinking and when you wake up the next day, do you feel anxiety, profuse sweating, high blood pressure? Do you get tremors? And the days that you're not drinking, are you getting hallucinations because of which you're not able to sleep? And the last question is, recently have the frequency of your blackouts and passouts increased? For those who do not understand the difference between blackouts and passouts, let me explain that to you. Blackout is a situation where the alcoholic is behaving, is acting, is awake, but when you ask him the next day morning, he says he doesn't remember. That means he was unconsciously doing whatever he did. So that's a particular stage where an alcoholic can remember things before a drink, and from that drink onwards, he doesn't remember what happens. Pass out, on the other hand, is when he gets drunk and he sleeps off, he passes off. So that means he is not creating any more concerns around. So has the frequency of your pass outs and blackouts increased? Those are the 10 questions. If you have answered 5 or more yeses, then there is a possibility that you either may be a heavy drinker or an alcoholic. You need to be careful. You can start taking consultations. If you have more than 7 yeses, then I think you should immediately find out an AA meeting near you, go there, attend those meetings, understand more about the diseases, hear experiences from people around there, and then you can make up your mind. But there is a high probability that you're one if you have more than 7 yeses. So with that, we'll stop this discussion about alcoholism here. We'll continue in the next episode. We will talk about the different types of drinkers. The people who are drinking are also categorized into different types. That is what we'll discuss the next, and alcoholic being one of them, so that we can try to figure out which bracket we fit in. See, once we know the disease, the biggest problem with alcoholism today is that people don't know what the disease is. Ignorance always creates a lot of confusion. So once we are clear about the disease, the problems behind it, which most of it we know, then we'll come up to the solution as well, and it will all make logical sense. So stay with us if you find this content worthy. And I would also thank all of you to have listened to this episode patiently and with love. Thank you all, and until next time, Pranama.